Today, we're joined by Dr. Adrian Gonzalez, an interventional radiologist at the Memorial Sloan Kettering Cancer Center. Dr. Gonzalez will share his journey as an academic interventional radiologist. Why did you choose an academic career?
I think that's something that people consider all the time. Like, what will be the right setting for me? Where I think my job will have more meaning personally, personal meaning. And everybody's different. And as you mentioned, I have been involved in fellowship training for a year. And the bottom line, I think, is there's no right or wrong answer. I think it depends. What are the things that you consider important? Both things, work careers are extremely fulfilling. Both have great things. And I decided to go into academics mostly because of teaching. Now, that was something that really made me think that my impact in healthcare will be bigger. Being able to help the next generation of people to train and grow in their careers made me think that that will be a much bigger impact than most of the other things. And that answer might be different for different persons. But in my personal situation was teaching and being involved with residents.
What brought you to be interested in education?
I think that everything has impact on healthcare. Like when you have a patient on the table, like the fact that you're able to help them has an impact for them. And that's super important, maybe one of the most important things. How do you spend that impact is in my personal life and my personal career has been by being involved in teaching and helping people to take good care of their patients. Because I think that at the end is like a chain of events, a positive chain of events that helps at the end a lot of people. And that's something that realize not right away, but with time. And I've met a lot of people in my career, and sometimes people think that it might not be that relevant, but the truth is it's one of the most relevant things that we can do as physicians. Train people to make sure they take good care of patients, and then and the good news is most of the people are highly motivated. We have they're in this field because they really want to help patients and they want to do a good job. So that helps a lot. But definitely there's a need for guidance, in terms of how to take care of patients, what are the important things. So that's how I decided. I think also research has a very super high impact that sometimes due to the constraints of the clinical setup suffers a little bit. Because it's pretty clear. Very few people will come with ideas that will change practice. That's the truth. But when it happens, it's just amazing. So definitely the ground should be set for people that are interested in doing research to be able to come with time to think about these ideas and these problems and try to find solutions. And all needs to happen between this constraint of time and resource.
And how do you divide your time in academic practice between teaching and other responsibilities?
Well, it depends how you see the dividing of time. Obviously, the training that we do or how we train is embedded in the clinical care. So it's something that is difficult to measure. It happens all the time and it's constant. It's something that in your departments, when you're attending, you're supposed to divide them for multiple reasons. They're supposed to put a number oh, this is the amount of teaching that I do and this is the amount of research that I do. But the truth is teaching happens all the time. And you have these daily interactions with people that are in different levels of training, also different healthcare workers. Where teaching is also for other people that is not just the resident. So I will say most of the time you're involved in that. Now, formal teaching, that is the description about lectures and direct teaching of residents and other trainees, that needs to come with a number. And I guess for most people that are in academic career, that might represent maybe 20, 30%. But again, that's not real teaching. That's a number that you need to put there for the department and the administration, which I think is, it needs to be like that, but it's also not reflective of reality. And how do you divide it? Yeah, of course, we have scheduled things, where we're supposed to teach and be together with the residents and things like that, And then we have, and depending how your career evolves, if you decide to go into research, it will depend on how much salary support you have in order to have that protected time for research. And when you get started, most institutions, most academic places will offer people, 20% of respected time for research. Like if you have an interest in academic career, that's like very common, 20%. And that's, I think in most institutions, that will be very flexible. Like you can talk to your chair, if your chair is supportive or your division chief is supportive, then you might get a little bit more research time protected during the first years. And then it's really up to you to be able to increase the number based on grants and things that you get involved with. And now, like working in organizations and national international organizations, that almost comes from your personal time. No, it's not something that it's embedded into the clinical work or your daily schedule. No, that's something that you do something like for certain organizations, and then you need to use your time. No, but it's I will say it's not very easy. And what I have seen over the years is like people struggle during the first years to be able to set up a balance between the things that they want to do. No, and also like, and most institutions have been the same. No, the clinical care is taking over most of the time that you spend in the hospital or in the institution at work. So yeah, unfortunately, sometimes you need to come from your personal time, and then it depends what you really want to do and what priorities do you have.
What do you think are some of the skills or attributes and mindsets that trainees should cultivate to flourish in academic radiology, and how should we cultivate them?
When you are in academic radiology, you're supposed to teach the next generation of people. You need to have some kind of research activity and help multiple organizations, not like in the national, international level. So yeah, it comes with a challenge. So you need to be ready to be time consumed at certain point at the beginning. Now it's very clear that it's not an easy to try to do everything. And then people over the years decide what are their priorities. And life changes also. I remember when I was fresh starting from fellowship, out of fellowship, at that point it was very clear for me that I like to do teaching and be involved in academia. And I was working in Mexico. So I have like this public academic job. In the mornings and the afternoons I have like this private setting. And that's a very common setting in Mexico. But obviously I feel like, well, I want to publish some things. I have these questions that I want to answer. Now I want to work in this or that. That idea evolved over time. Now I eventually came to the US, now where I thought I think the setting is more well organized for people to try to live in academic medicine. And then here, like, it's just a little bit more organized in order for you to develop whatever skills you have. Of course, like there's the constraint of time. When we moved here, like our daughter was super young. She was like 3 months old. So it was like,
Mm.
now something else needs to take priority. Now it's like, I cannot be just thinking on other stuff and trying to use all my time. And that was a personal decision, now that it's sometimes difficult to make. And flexibility, I think, is one of the most important things. You need to be flexible in order to adapt to changing situations or changing departments or changing requirements of your department. And that will definitely help you. You definitely need to enjoy or at least not dislike being involved with residents and training and teaching. Not everybody does it, not even in the academic institutions. Some people might be less involved because they have other responsibilities, and that's good. But again, that realization comes with time.
So, what is a piece of advice that you would give to graduating trainees who are still deciding where to practice?
I think they should try to experience both sides. I think it's difficult during training to get exposed to it. I think a good combination that we have at Sloan and many other institutions have it is like there's certain rotations that are outside your academic institution. Like people can go to an OBL and see how that setup works and see if they like that setup and if it makes sense for them. Obviously, not every private practice is the same. And there's also like hybrid systems, like are really private entities that are embedded in academic institutions, which I think is a very interesting setup that might offer the good things of both worlds. There are a few of them, and I think it's a little bit more difficult to get exposed to those. But again, people should know that there's those institutions that have that kind of setup. I acknowledge that it's not easy to be able to see them firsthand, but I guess at least know or talk about it and talk to people that are, and like it's interesting, like there's a lot of meetings where like this topics come up. And like you have people talking about like how is IR in the private practice, how to develop a private IR work. And I guess if you get involved into those or go and listen and see if anything makes click with you, that's pretty useful. And the truth, like most of the people are used to academia, because they train academic setting. So they already know more or less how is the private world, the academic world.
I understand that you have been in both academic and private practice when you were in Mexico. So is there anything that you dislike about either academic radiology or private practice?
Well, I think private practice is a little bit different in Mexico. I don't think that I have the experience here to say if I dislike something in general about private practice because my experience is from Mexico. So, and memory is tricky, you only remember the good things. So it's not that I dislike my private job in Mexico. I think it was a good private practice, the good colleagues and good environment. I don't think that I didn't like something, but I can tell you like I didn't like that shift during the day that I need to move from one institution to another. So I think that was like not ideal, which is something that is good here in the US. Now you have a one job and like there's people that have others. Not like most of the people have one job and that will be it. They don't need to divide in the day, which I think helps a lot in order to take good care of patients and do other things that you need to do. What do I dislike about academia? I don't know. I think I sometimes joke about it, but like I think like departments should have like a simplification department or division. Like sometimes it becomes so bureaucratic and like there's so many rules and many steps for multiple things. And sometimes I think that goes against us, against like doctors are working. And it happens at multiple levels. Sometimes it can be difficult to break all this bureaucracy that sometimes grows in the institutions and we allow them to grow. And sometimes the excuse is better patient care, like more paperwork or more steps and those things. I think that's something that needs to improve.
Thank you, Adrian. Thank you again. We really appreciate you having
Thank you,
been
Jason.
here.
Thank you so much, Jason. Nice to meet you.
In the next episode, we'll be talking to Dr. Matthew Lundgren, an interventional radiologist and the Chief Data Science Officer at Microsoft Health and Life Sciences. So stay tuned and remember to rate, review, and subscribe.